Hello and welcome to the PT's PT podcast. I am your host, Dr. Sean Lordan, and today we've got a special guest, Brogan Walsh, DPT and TPI certified.
Yeah, thanks for bringing me on.
Yeah, we're here to talk golf today and a little bit of physical therapy.
Topics.
So, do you have your CSCS too?
Not yet. No, think about it. It's on the horizon. Absolutely.
Good. I love that. So, Brogan is one of our all-star PTs here at Concierge PT, and so we're here to talk all things golf today. So,
love it.
Sutton is really our home base here at Concierge PT. It's our largest clinic, and Brogan is one of our busiest therapists here, and has had some great experience in the field so far, and really specializes in orthopedics, golf, sports medicine. But just tell us a little bit about yourself, Brogan, your history, what brought you here today.
Yeah, so
your love for golf.
Yeah, so I started golfing in college. So I got a late start to it when other sports started to lose their interest and take a little bit too much time. So I picked the sport with the longest round and spent the most time with it. I went to UMass Lowell for physical therapy school, which is 7 years of undergrad and grad school together. I came out of school, worked for a hospital, decided I was moving more into the private practice area. Got actually an email from Brooke and decided, hey, let's try it out. Let's interview. Let's see how it is. I always was told that the important part of your job is who you work with as well, and who you work for, because if you spend most of your time at work and don't like where you work or who you work with, it's tough. So when I came here for the interview, everything was, I met everyone with a smile, and everyone was super excited to meet me and to hang out and to, show me how we worked here at CPT, and everything's been so positive and everyone works so well collaboratively that it's just, for me, it was an easy transition. And then when we started rolling out the TPI stuff, I couldn't be more excited. When we got the golf sim going downstairs, I spent far too much time there. But yeah, it's great. We get to bring golfers and patients through screenings and bring them into the TPI room and the simulator, and to allow them to enjoy the game of golf with less pain, which is really for our amateurs, that's what we want, right? We want to just be able to get out there on the weekend and enjoy it and shoot well and make the next weekend something to look forward to as well.
That's great. So we mentioned the TPI certification. So tell the audience what that stands for.
Yes.
And what it entails to, and I think there's different levels to it too. Yeah. But what does it entail to become TPI certified? Yeah.
So I'm TPI level 1 with plans to go kind of through the full 3 levels. So it's 15 movement screens set by. So it's Titleist Performance Institute. So it's a movement-based screen for golfers, right? So we're looking at a way to work collaboratively with the golf pros and the people who make you swing with more skill, right? Our job is efficiency is the best word. It's you have a swing, I have a swing, they're different, right? Doesn't that make your swing better than mine? No, it just means that we need to make sure we can find a position in a swing that works, and that can work repetitively, right? So TPI is all about making people move better and reducing the amount of limitations that they have. So for a patient with low back pain, if they're going through some of the testing and they have a poor job of rotating to the left, I'm a lefty. If I can't rotate to the left, my backswing's terrible, right? So as we break people down in the TPI screening, it allows us to help them better see where their limitations are. In that position, we're saying, okay, you have bad rotation, let's work on that. Here are 3 or 4 exercises that I as a PT and I as a TPI specialist love, right? Do it every day, come back in 2 weeks, let's check it again. And you should show improvement by then. There should be some sort of change physiologically that, okay, you're feeling a little bit less tightness in the backswing. Sure, maybe you're not hitting the ball further, but maybe it's a little bit less sore after the round. So, because if you think about a golf, depending on how good you are, you're swinging, 90 times, probably 60 of them are full swings. If it hurts to rotate, then it's gonna hurt, right? Because at that point, you're just trying to remove the small limitations that people have so that they can enjoy the game and swing more efficiently.
Where do you feel like that TPI assessment stops and then you put your PT hat on?
Great question. So right after people go, okay, I failed this test, what do I do now? I think that at that point is where I stop and say, okay, now we're going to put the hat on and say, this is where you struggle. Here's my years of experience as a physical therapist where I can change that. Because people look for you for a reason why and then a reason to how to fix. So I think the TPI assessment does a really, really good job of telling you what's wrong. And then the PT part of it is, how do I make this better, right? How do I make you do what you're struggling with and teach you through it that it's going to be okay, we're going to get there. And that not everyone's perfect. There's a test that I think the value is like 78% of people fail it. And part of that is because like people have to fail something because there has to be something you can improve on. Right. So I think there's a really clear stop point where it's like, okay, now it's my turn as a PT to like fix this.
Yeah, I think that's really interesting. I think of the FMS, right? Like the basic movement screen. And I think the last piece of the FMS is like the ipsilateral, like quadruped thing where you're just like the ipsilateral bird dog, I think is what we call
exactly
it.
What it was, yeah.
Like nobody can pass that,
no one.
Right? So like
Not
I feel like the
chance.
TPI's, like what do you think is the TPI's version of that?
Yeah, so it's the overhead squat.
Yeah.
Instantly.
So like, and that's where I think, as PTs, like we joke about it, like, I think any good PT incorporates a functional movement, especially for folks who present without pain, at initial eval, like they're a 1 or a 2, and it's like, oh, well, I don't have any pain now. Like, okay, well, show me a squat, show me a single leg squat, show me a bridge, or not a bridge, but like a lunge. Like if you have knee pain and, and it's not elicited by any of those, like there's something else going on. So talk to me more about, you find those deficiencies, like, is there a period where you retest after somebody's like, how long does it take before you retest?
Yeah, so that's a great question. And there's no set time. I guess it does depend on the injury at hand or the limitation at hand. If it's a small like reduction in rotation of we'll stick with the back. If you're getting tightness as you rotate to the left, sure, it's going to take some time to make that change. So, 3-4 weeks of checking in with the PT or the TPI specialist, whether email or text or whatever, seeing how the patient's feeling as long as they're not like having pain, and then retesting 3 to 4 weeks later and saying, okay, like, is there a difference? Do you feel like you felt a change in your golf game? And then checking the test again and saying, okay, listen, like you've improved here, and now and this is where I think it's tough for people where they can fail a test and still have improvement, where it's you test the first time and it's clear and obvious that you failed. So the one for me is like the rotation for the shoulder. For that, I need to look at it with a number, because if you come in here and this is your external rotation, and then we work for 3 or 4 weeks and you come back and you're now here, but you're not touching the wall, you failed. But you've gotten better. So a patient or a TPI or a golfer will look at that and say, well, why am I doing this? I'm not getting better. But you are getting better, because we need to be able to quantify it. So I'll say, like, okay, listen, you've showed improvement in this period of time. Like, let's keep going for another 3-4 weeks. Keep working on it. We'll see if we can get our rotation better.
How do you have that conversation after the first day of the screen?
Yeah.
The eval or whatever. What does that conversation look like? Like, how are you setting expectations? All that stuff.
One of the things I talk about too is the duration that person's been golfing, or the duration that person's been moving that way. If you're someone who is, you get a lot of people like in their 30s to 40s to 50s, right? So if you haven't had like a traumatic injury and you're just kind of stiff, well, you've probably been stiff for a while. If you sit at a desk all day and you're hunched over your computer, more than likely you're tight if you're not going it through like a mobility session a couple times a week. So we're working against 10-15 years of inactivity. So at that point, with a golf trip every weekend,
30 or 40 for some people,
something,
maybe 50.
And at that point, like, the conversation is don't give up, because you're going to improve. Like, we know this works. We know that the PT aspects and the TPI stuff together just works. So it's about showing the value to the person and explaining the processes that happen and allowing them to truly improve with the intervention you're giving them, and saying, like, this is an example I can give you from this person, or this is what I've seen in PT. And that's a good way to kind of meld the two together again, where like you don't see as many TPI golfers as you do, or patients as you do patients in a clinic. Like, when you see 60 plus a week, sure, like I've seen a lot of people with back pain, right? I can tell you this is the improvement when they've had a traumatic injury. So it's going to slowly get there again. Yeah.
Yeah, I think, and one of the things you mentioned is, you're going to get better, right? Like you're going to incrementally get better. I just talked about this with Fran Quinn on the other podcast was, setting those expectations from the forefront or from the get-go, whether there's pain present or not, is so crucial, right? So like it takes 10 to 12 weeks to permanently really change muscle tissue. Right. And I think, we talked about habits and having like the coach, or really in this case, the PT, telling you exactly what to do and being compliant with it. Right. Like, but the stretching every day piece, like, and if you need to change tissue, like it is clinically proven and studies show this, like you literally need to stretch every day. So, as a PT, what I would do is like I'd pick the 3 main stretches. Right. Because if you give people any more than that, it's just cognitive overload and it's just too much. Do these 3 stretches, but you get those stretches from the TPI. It's great. Like the external rotation stretch, you do like maybe a hamstring stretch or a hip flexor stretch, low back rotation, thoracic rotation. Pick up the top 3, and then like 12 straight weeks. And then you see those tissue charts, the pliability charts, the muscle length charts start to really change over time. The second piece of it is, as we set expectations just in general in PT, what I find newer grads and PTs that aren't as confident as we are, is that they say, okay, let's let's book out for a couple weeks, do this, and like you're going to get better. But what I think the missing piece, the missing link, Brogan, is like they literally don't know if they're going to get better because they read it in a textbook somewhere that their patient should get better, but they don't know yet because they haven't seen it yet. And I think that's where, like, when we talk about golf and performance, it really is just like, you and I both know it's something that it's going to take years to improve, but like people don't work in years, they work in 24 hours, a week, can I just accomplish it? Can I do the stretch this morning? Can I do it 2 days in a row, 3 days in a row? And like, I think keeping people motivated is so tough. So like, what are some of the things that you do on a daily basis to keep, like, let's just talk about your athletes, your golfers. Like, what do you do to keep them motivated so that they continue to get better? Yeah,
so I relate it back to their activity. So for golfers, right, you want to spend 4.5 hours, depending on the course, out there playing golf. If you are dealing with something and you want to do it well, and you're trying to improve on some aspect of your swing and you're not doing it every day, then what's going to happen is you're going to get to the weekend and either you're going to have pain with that same activity or you're no longer going to enjoy that activity as much as you can. So I try and be very frank with people where if you want to continue to show an improvement and benefit from what we're doing, then you have to stick with it. And a lot of the times it's, I use the knowledge and the experience from other people that we've worked with where like, hey, I had this patient, he's very similar to you, and this is what his progression was, and I'd like you to try and like see this and try and emulate it yourself so that we can get some similar progression out of it. And then just communication with the patient or with the athlete, because nothing's worse than being stuck there with no one on your side and trying to be the person to like they can lean on. So I give every one of my patients on my eval my card with my email. Like anytime, email me. I have a guy that emails me at 9:30 at night almost every Saturday.
That's a dangerous game.
Yeah, but I get back to them when I get back to them. I do my very best, but I want people to feel like we're invested as well, right? Because people come to us because we're the next, hopefully the last stop on this either pain train or the ability to get back out there and play or to continue to play. And I want them to feel like I'm in their corner no matter what, as that's my job and that's what I love to do. So I'll take the email at 9:30 and I'll get back to them, or I'll get them when we can, but trying to keep them feeling like they're supported.
Yeah, and I think one of the main differences of the way that we do things here at Concierge is we work a lot with our hands, right? We use Graston technique, we use dry needling. Yep. We have a shockwave machine to really like get deeper than needles and in our hands and in our with the Graston technique. Yep. Tell me, and we work in teams, right? So like, and Fran and I were just talking about the importance of having 2 sets of eyes on a case, right? Because there are things that Jake might see that you miss, right? And I think the patient wins in the scenario where there's and I think once you get more than 2 PTs involved in a case, I think it really starts to get a little muddy because then it's like who's driving the plan of care, and it can get a little sticky. But I think if you've got an aligned team working with, especially an athlete or really anybody, like there's so much power in that. So Can you talk to, your experience in like working as a team,
Yeah.
Especially as like, you're both TPI certified, you and Jake, but like
Yep.
talk about working as a team, and then tell me more about like how you're using your hands to really get these patients better.
Yeah, so I work with Jake, who's a TPI certified PTA, who's phenomenal. And the best part about working with Jake is he's a clear soundboard. So if I have a question or if I'm seeing something, I'm like, hey, what do you think of this? He's a very honest feedback. And so a lot of the times patients will be seen by either one of us at one point, and same thing with our golfers. And we'll comment back and forth while the patient's there and, lend a hand or an eye, like you said. I find it very helpful to have another person there in case there's something like, okay, it could be this, it could be this. Where do you think, what would be your next step? What would be your eyes? What are you seeing? And Jake's great at that too. When it comes to the hands-on approach, it's different than other places that I've worked and places that I've been for PT in general, like when I was younger. I think it does two things. I think it helps build the rapport with the patients, and then I think it allows for change of the soft tissue that we don't get when you're just exercising, right? The tendinous change you get with the shockwave is just so much better than just, massaging someone with their hand, because it's what it's made for. I think it does a great job of that. And then using those Graston tools and the, any sort of like instrument assisted stuff where we're working on getting into that tissue and generating blood flow so that tissue could heal better, I think is super helpful. Same thing with like the cupping technique that we use here as well. And then I like to do a little bit of the dynamic cupping, so they're moving through range of motion that are normally painful. We're putting that cup on it to not only distract the nervous system, but also to bring blood flow to that area as we're working on it. So I think the tools we have here make it almost easier to be better at our job, which is great because I appreciate it.
Yeah, and it's interesting, and I think as a field, and I talk about this all the time, but we don't do a great job of qualifying or quantifying muscle quality, right? Because we can't peel away the top layer of skin and look at trigger points. Right? So I think, when we're writing an eval or a re-eval, we talk about, especially young athletes, a lot of times they're presenting without pain, right? They have full range of motion and their strength is 5 out of 5, right? But when you ask them how they're doing or how they're feeling, well, I still have pain, occasionally, on occasion. I'm not back to 100% because I still can't ski or golf or, play tennis or whatever. What's that 20%? Right. When we talk about, again, it's, we're not using, you can't have you can't diagnostically ultrasound every single patient and be like, oh, well, there's a 2x2, centimeter trigger point that I'm working on. And,
right.
We get a local twitch response and it's great. And, and document all that. I think that our role truly in the healthcare system is we heal with our hands, number one, because we're changing the pliability of the tissue and lengthening it. And then two, we just talked about this, but like really combining all the effects of like the healers in medicine, right? So chiropractic, physical therapist, manual therapist or massage therapist, and personal trainer, like all four of those things into that doctorate degree. Right. So you've got the didactic knowledge of like, okay, this is the issue, this is clinically what's going on, tennis elbow, whatever, and we'll talk about this in a little bit, what you commonly see in golfers.
Yeah, absolutely.
Identifying that, so we get a diagnosis, and then okay, so here is how we're going to treat it.
Yeah,
and we can talk about golfer's elbow, but it's actually tennis elbow that affects more golfers.
Yep.
Talk to me about, I'd love to hear about like how shockwave has affected those outcomes for you.
Absolutely.
But talk to me about the most common injuries that you see in golfers, and how you're fixing those.
Yeah, so I mean, I'd say probably the number one thing I see is like low back pain. Typically, the first question in my mouth is, "What's our warm up? Are we going to the first tee and just ripping driver?"
Yes, 100%.
Yeah, right. So instantly wrong, right? We're not doing any sort of dynamic warm up. So one of my patients, actually, my first TPI patient was my older brother.
Love that.
Yeah, who told me it's okay to talk to him about him. He herniated his disc, took him through PT, and then he was still having pain with golf. So I was like, okay, listen, this is what I want you to do before you get to the course. This is what I want you to do at the course. He's a weekend golfer, loves it. And you'll get him on the first tee of every tee box, open books, right in front of everyone on the ground, even if it's wet. The kid just grinding nose out just to get loose.
Yeah.
Worst thing he wants to do is go back to the position he was in with pain with all of his activities. So first thing I'd say to people is, especially with the low back pain, which is probably the most common thing I see for our golfers, is be ready to move, right? you don't get in the car in the middle of the winter and slam on the accelerator. Why do we do that when we golf, right? So there's that. We see a lot of, epicondylitis of, medial and laterally. We do use the shockwave here, which I think does a really good job. It is mildly uncomfortable in the moment, but it does help produce that change in the tissue that we're looking for.
It feels like a tapping.
Yeah, it's I wouldn't say painful, but just it's a stimulus I don't think I've felt until I tried it for the first time. And I was like, oh, it's like pressure, right?
Yeah.
And that something's happening. Yeah, it's not like you're getting just a regular ultrasound and someone's just waving the magic wand on you. So I think it does a really good job of getting into that tissue and changing it, which is exactly what we need. Same thing we'll do. I like to do a lot of like pin and stretch when people are like moving through the range of motion while we're holding on those tendons and those tissues and those tight spots. So they're getting that decrease in tension and tone in those extensors in the elbow and the wrists, and then loading it, right? Because getting our grip strength, getting the forearm muscles stronger takes time. And so our body only grows when we give and improves when we ask it to, right? So you need to give the tendons and the muscles and the bones a stimulus for them to change. And a lot of the time that turns into a weight, some sort of resistance movement, which very rarely do we go to the gym and we do like wrist curls, right? You go to the gym, you hit chest, biceps, all the show muscles, but we don't go out there and get the muscles that are important with our sport, right? So that's one of the things we definitely need to improve upon to decrease the incidence rate of one of the major injuries we see in our sport. But that usually only happens after you've been to PT or after you've had your TPIs or screening. So most of the time that ends up with us having to educate that on patients.
So, I know a lot of people go to YouTube for their rehab advice nowadays, and like web, the older generation goes to WebMD or whatever.
ChatGPT AI
stuff. Yeah. And then, the younger generation goes to YouTube. It's like, hey, how do I fix tennis elbow, whatever.
Right.
And so what do you say to those folks who have already tried, I did this stretch, I did that stretch, I did whatever the computer told me, or, YouTube. How are you managing those expectations of those patients?
I say, great, you have a mild background of what we need to work on, but there's so much more than just the 30-minute or 12-minute YouTube video that you're watching. So first off, you're not getting the manual techniques there. You're not getting the shockwave. You're not getting all of the things that we have here. And most of the time, people don't have the equipment we have here as well when it comes to ways of creating resistance. And don't get me wrong, there is good stuff on the internet to help people, but it's a part to a whole. And so we need to work more on, when they come in, working on the whole person, working on the whole arm that's causing you these symptoms. And sure, maybe you have what feels like tennis elbow to you. And the first thing that happens is we have to evaluate it, make sure what you're saying you have. If you're dealing with, elbow pain and you think it's from your, extensors and it's really some sort of referred from your bicep, well, you wasted all that time on YouTube and doing your exercises and stretches, and you could have been in here. We could have got you better faster. That's
such a good point. I mean, that could be it could be, coming from your neck, could be cervical radiculopathy. Yeah. There's a lot of things that need to be ruled out.
Right. But we just go to YouTube and say, okay, this has got to be.
My elbow hurts. What do I have?
Yeah, exactly.
So, I think that's really interesting. And I think that, to your exact point, when those folks come in, it's like, great, I'm glad that you've educated yourself, right?
Yeah.
So now the work starts, because now I'm going to see actually what we look at is what's the range of motion look like? What does it look like compared to the other side?
Yeah.
Right. So you just really start to you can get 10% online probably with everything in life now, which is great. But then how do we individualize that care? And again, I hate when people are like, oh, well, there's PT clinics that are like cookie cutter PT clinics. The bottom line is you're going to use a lot of the same exercises for tennis elbow, whether the patient's 50 years old or whether they're 20 or 75, right? You are depending on what their tissue looks like and past medical history, all that stuff. The rehab is the rehab. You're going to strengthen the tissues around around the joint. But I do think that especially for a golfer, a difference in 10 or 20 degrees of lumbar rotation or thoracic rotation, the difference of hip rotation or hip flexor mobility or glute strength, those minute differences that you pick up from those TPI screens can really have actual, swing, not only swing speed effects, but just,
balance all of it.
The whole thing.
And two, with the hip rotation too, it matters if you're right-handed or left-handed.
Yeah.
If you're a person who has if they're having pain with rotation and you're a right-handed and you're getting into that full position to your backswing, and sure, it might hurt with internal rotation, but maybe the external rotation is really you're tight through the external rotators, you're not getting into that full position, and you're causing like an early extension or something that's causing you to have a poor swing and pain. So not only are you now struggling to golf the way you want to because you're playing poorly, but you're in pain as well. So it takes the enjoyment out of the whole thing as well.
Yeah, I think it's, and we can kind of talk about that just a little bit in terms of, how, where you transition from, working with your TPI certified specialist to now working with a professional golfer. Right. So if you've got, we know all these drills from TPI because it teaches you, basically how to fix early extension or some of these common swing problems. Talk to me about your role in combination with that PGA Pro.
Yeah, absolutely. So we are the movement specialist. I am not the golf specialist, right? Yeah. If I was, I would swing better. I would have a lower handicap, right?
Me too.
So the way I always look at it with whether we're working with a golf pro or a professional that's coming in, it's the main line is we're making you move better and more efficiently and making it hurt less. And their job is to make you swing better, is to make you shoot lower. We make the clay usable and they mold it into a golfer, right? So we say, okay, I'm seeing poor stick with the back, so poor rotation to the left during the backswing. Okay, well, we fixed that. Now you all have all this extra range of motion, and as you get into it, it's going to change the timing of your swing. Okay, well, I can try. I can promise you the golf professional knows more than I do. So speak to him. They'll be able to send things back and forth, and we can work together to try and improve you moving better and moving without pain, and then swinging and shooting a score that's lower, and getting you a swing that you can swing efficiently for an extended period of time.
Yeah, I think it's a good marriage. I think.
Yeah, absolutely.
And then the last piece of that would just, be the practice component, right? So in your opinion, how do you kind of, prescribe how often a patient should play golf or practice? Right.
So, there's always something you can do, right? Even if you're really sore, or let's say you golfed yesterday, right? And you're, I'm a little sore. I don't feel like playing a full 18. Okay, well, there's a huge continuum of practice we can do. So let's work on our range of motion. Let's work on our mobility, right? Let's work on stability. Let's get out there and do the exercise you've been prescribed. And then if you want to build in some golf, we work putting, chipping, pitching. The things that require less force and rotation and is more motor planning, right? So at that point, we allow for the same idea that you have to give your body time to heal. So it's like you wouldn't play a soccer game and follow it up with another soccer game the next day without expecting to feel sore, right? Golf is a 4-hour sport, at least, right? If you're playing 18. And even when you're taking a cart and enjoying it, sure, it's still a lot on your body. So giving yourself that day of break between playing a round, unless you're in a tournament, and then sure, you're going to be sore the next day, but you'll get over it. But allowing yourself to have that, dynamic warm-up, the cool-down afterwards, all the important things for recovery as well, that are going to allow you to get into the next round or the next practice zone without having discomfort is super important. So giving them the time they need would be, I'd say focusing and shifting their focus on, let's work on different options. So let's work on different aspects of the game, and then allow yourself to practice those things and get good at it. So part to whole training when it comes to that.
Yeah, I think that's great. And I think just talking about the different levels of pain too.
Yeah. Right.
So there's pain that you just can't move through. Sure. Like that sharp pain and hey, listen, if you're gonna have sharp pain when you golf, probably give it a week and take a bunch of ibuprofen and take some time off. But pain is part of the recovery process too. You don't just go from a 7 out of 10 pain to 0 out of 10. It takes time to move away from that. And I think that's where educating people it's okay to work with your coach today. It's gonna hurt,
absolutely.
But just moving through that is not gonna put you back to square one.
Right.
Just do exactly what I tell you and you're gonna move.
Right.
You're gonna get the results you're looking for.
Yeah, and evaluating that pain, like you said, what's the descriptor? Are you just stiff and you're saying you're in pain? Okay, well, let's move and see if that stiffness goes away. Let's
Yeah.
give it some time. Let's warm up. Let's give the body a chance to move better.
Yeah.
Yeah.
It's great. So closing tradition. Favorite movie?
Favorite movie? Wow. Tough one.
See, Bonnie gets to hear all these. And she's like,
Favorite movie? I'm a sucker for Bruce Almighty.
okay,
Yeah.
great movie. Jim Carrey, huh?
Jim Carrey.
Prime
Hilarious.
Jim Carrey.
Prime. Yeah, so funny.
And Morgan Freeman, too.
Yep.
Yeah, that's a good one.
Yeah.
Favorite concert?
Favorite concert? Noah Khan this year.
What is it?
Noah Khan.
Okay.
Yeah.
I haven't
Fenway
seen it.
was really good.
Nice.
Yeah.
That's cool.
Yeah.
Words that you live your life by.
That's a good one. When you stop learning, you stop living. Yeah.
That's good. And the last piece is, a little bit more, kind of tailored to our audience, but
Sure.
advice for a new grad PT.
Ooh. Be okay with failing. Learn that you don't know it all right now, and that's okay.
What's one of your failures?
So many to choose from. I had a patient after a hip replacement pass out on me, middle of the room, in a hospital room, with no one there to help me. And I caught a 6'2" man on my knee and had to ask for help. Big failure. Yeah. But, poor setup for success.
Yeah, I mean, the first fall is always a little
It's
scary.
tough. Yeah.
Yeah, that's good.
Didn't fall. I caught him.
Yeah. Yeah. I don't know if he sees it that way, Brogan, but
He was fine.
that's
Yeah.
awesome.
Yeah.
All right, well, thanks for having, thanks for coming on today.
Thanks for having me. Yeah, it's great.
And this is great.
Yeah.
Awesome.
Thank you.